Hello, this is Dr. Nabih Mukhtar, Senior Clinical Fellow Critical Care Medicine UK, and in this video we are going to talk about analgesia in ICU. Hopefully you are going to enjoy this video. Pain relief is actually one of the most important targets in ICU. And there are two main groups of analgesics we are commonly using in ICU. The first group is opioid-based analgesics, and the second group is non-steroidal anti-inflammatory. Morphine is the first medication we are going to talk about, and it is the standard opioid medication. The dose needed to produce analgesic effect is actually variable between people because it depends on several factors such as tolerance and excretory function. But the usual dose in ICU for mechanical ventilated patients is 2 to 5 milligram as an IV bolus or by continuous IV infusion from 1 to 10 milligram per hour. Bear in mind as well that the morphine metabolized in the liver into two major metabolites which can accumulate in cases of renal failure. And then the pethidine, which is an old synthetic opioid. The usual dose is IV bolus of 10 milligram with an intravenous infusion with a rate of 10 to 50 milligram per hour. But it has a major disadvantage that it has an active metabolite, which is a norpethidine, which can be accumulated in cases of renal failure and might cause seizures. For this reason, pethidine is not recommended anymore in the critically ill patients. Fentanyl is a potent, powerful synthetic opioid. It has a rapid onset of action in comparison to the morphine, which has a slow onset of action. Also, in comparison to morphine, it doesn't cause histamine release, so it is preferred for hemodynamically unstable patients. The usual dose of fentanyl in mechanically ventilated patients as IV bolus of 50 to 100 microgram and infusion IV continuous infusion rate between 100 to 200 microgram per hour. Also, you need to know that the fentanyl has a short duration of action if it is used as an IV bolus, but bear in mind that prolonged IV infusion might be complicated with accumulation and slow recovery. Fentanyl or morphine PCA. PCA is a patient-controlled analgesia, which is a technique of analgesia administration that gives the patient the power to self-administer a predetermined dose of an analgesic drug through an IV-connected computerized pump. It is actually helpful for patients recovering from surgery, but the patient needs to be alert and demonstrate the ability to administer the demanded dose for pain. The average usual dose for morphine is 1 milligram with time lookout interval between 10 to 30 minutes, and the average usual dose for fentanyl bolus is 10 microgram with a time lookout interval between 10 to 30 minutes as well. Fentanyl is another new synthetic opioid which has the most rapid onset of action in comparison to other opioids, but it has major disadvantage that it can be inhibited by different types of drugs such as antibiotics and antifungal medication, so you can't predict the effect of the continuous infusion of fentanyl on the ICU patients. That made fentanyl is not the ideal analgesic medication to be used in ICU. Remifentanil is an ultra-short-acting synthetic opioid. It can be given as an IV continuous infusion with a dose of 6 to 15 microgram per kilogram per hour. But IV boluses of remifentanil are not actually recommended because there is a high risk of bradycardia and hypotension. But remifentanil has a great advantage of having short half-life and rapid clearance, and that makes a drug-free examination possible quite quickly. So that's why the remifentanil is an ideal analgesic for the post-neurosurgical patients who might need serial neurological assessment. Tramadol is a typical opioid that widely used in post-surgical ICU, and it can be given orally or intravenous. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are actually not commonly used in critically ill patients because of their side effects, which include anticoagulant effects due to interference with platelet function, renal impairment, risk of gastrointestinal bleeding, and acute bronchospasm. But it can still be used for young adults after trauma or major surgery. Examples of non-steroidal anti-inflammatory drugs include diclofenac and ketorolac. Ketorolac can be given intravenous and diclofenac can be given rectally. Ketorolac dose is 10 mg every 6 hours for no more than 2 days, and diclofenac dose is 25 to 50 mg every 8 hours. Also, ibuprofen 400 to 600 mg every 8 hours orally can be an alternative. Paracetamol, it is a non-opioid analgesic, and its dose is 500 mg to 1 gram orally or IV, and the maximum dose in any one per day is 4 grams. Thank you and hope you enjoyed this video, and meet you in the next one.